You wake up one morning feeling a little tired, maybe a slight headache, some body aches, a low fever. You think it is probably just the flu, maybe a cold coming on. So you rest, you drink water, you take some paracetamol and go back to sleep. But 48 hours later, your breathing becomes difficult. 72 hours later, your lungs are filling with fluid. And by day 5, you are in the ICU, on a ventilator, fighting for your life. And the scariest part of all? The doctors missed it. For days. Because it looked exactly like something ordinary. This is not a fictional story. This is a pattern that has played out in hospitals across the world. In real patients, real families, real lives turned upside down. By a virus most people have never even heard of. Today we are talking about hantavirus. What it is, how it gets inside your body without you even realizing it, why it fools doctors in its early stages almost every single time, what happens inside your lungs when it takes hold, who is really at risk, and the answer is going to surprise you, and exactly what you need to know to protect yourself and everyone you love. This is going to be a detailed video, and I am asking you to stay for all of it, because every section builds on the last. And by the end, you are going to understand this virus in a way that most people simply do not. Stay with me. Do not go anywhere. Real quick before we dive in. If you are new to this channel, our goal is to hit 1,000 subscribers. So if this kind of content is valuable to you, hit that subscribe button right now. It keeps videos like this coming every single week, and it means everything to us. My name is Dr. Frank. I am a general physician with over 2 decades of experience. And on this channel, every single week, I take complex medical science and break it down into clear, honest, practical information for people who are serious about their health. Today we are going somewhere most health channels never take you. Let us begin. Before we get into the science, I want to tell you a story. In the summer of 1993, a cluster of young, healthy people in the Four Corners region of the American Southwest began falling ill with what seemed like a severe flu. They were not elderly. They were not immune compromised. They were active, healthy individuals in their 20s and 30s. Within days of their symptoms starting, several of them were dead. The medical community was alarmed. Here were young, healthy people dying of what looked like respiratory failure, and nobody could explain why. It took a team of investigators from the Centers for Disease Control working around the clock to identify the culprit, a previously unknown virus, carried by the deer mouse, a small, common rodent found throughout North America, a virus that had almost certainly been circulating silently for years, but had never been identified because the cases were scattered, rare, and always misdiagnosed. They called it sin nombre virus. In Spanish, the virus with no name. It was the first identified strain of what we now call hantavirus pulmonary syndrome in the Americas. And that outbreak, which killed more than half of the people it infected, changed the way the medical world looked at rodent-borne illness forever. But here is what haunts me about that story. Those people had been exposed to something completely ordinary: cleaning cabins, sweeping out storage spaces, doing the kind of mundane tasks any of us might do on a weekend. And they had no idea, no warning, no reason to think they were in danger. That is the nature of hantavirus. And that is exactly why understanding it matters. So let us talk about what this virus actually is. Hantavirus is not one single virus. It is a family of viruses belonging to a group called bunyavirales. Different strains exist on almost every continent, and different strains cause different diseases in humans. In the Americas, the primary concern is hantavirus pulmonary syndrome, or HPS. This is the strain that attacks the respiratory system with terrifying speed. The case fatality rate, meaning the percentage of people who die after being diagnosed, ranges between 35 and 50%, depending on the strain and the speed of treatment. In Europe and Asia, different strains cause what is called hemorrhagic fever with renal syndrome, or HFRS. This version attacks the kidneys instead of the lungs. It is generally less fatal, but still extremely serious. Today we are focusing primarily on HPS, because it is the most aggressive form and the one most likely to be encountered and misdiagnosed in clinical settings. Now, every strain of hantavirus has one thing in common. It is carried by rodents. Specifically, each strain of hantavirus has what scientists call a reservoir host, a specific rodent species that carries that particular strain. The deer mouse carries sin nombre virus in North America. The cotton rat carries another strain in the southeastern United States. The bank vole carries Pumala virus in Europe. And here is the critical thing to understand about these reservoir hosts. The rodents themselves do not get sick from the virus. They carry it. They spread it through their saliva, urine, and droppings. And they go about their lives completely unaffected, while the virus waits for an opportunity to reach a human host. That opportunity almost always comes through the air. When rodent droppings or urine dry out, they become fragile. They crumble easily. And when disturbed by a broom, a vacuum cleaner, a passing foot, even a gust of air, they release microscopic viral particles into the surrounding environment. Those particles become airborne. And when a person in that space breathes, those particles enter the respiratory tract, travel down into the lungs, and begin what will become one of the most dangerous infections the human immune system can face. You do not have to see a mouse. You do not have to be bitten. You do not have to find droppings. You just have to breathe in the wrong place at the wrong time. I am going to put a diagram on a screen right now showing exactly how this transmission pathway works, from the rodent to the droppings to the air to the human lung. Go ahead and screenshot that if you want to study it later. Take your time. I will keep going. Let me ask you something directly. When did you last clean out a garage, a shed, an attic, a basement, a space that had been closed up for months? When did you last go camping or stay in a cabin that had been shut up over winter? Have you ever swept out an old storage room without wearing any protection? Because statistically, if you have done any of those things, you have been in a potential exposure environment. Keep that thought, because we are about to talk about exactly how this virus moves through the body once it is inside. This is the section that most health videos skip over, but I think it is one of the most important parts of understanding hantavirus. Because when you understand what the virus is actually doing inside your body, the symptoms stop being random. They start making complete sense. And that understanding could help you or someone you love act faster when it matters most. Now, let us talk about the clinical progression, the 3 phases of hantavirus pulmonary syndrome, and why this virus is so consistently missed in its early stages, even by experienced physicians. Phase 1. The prodromal phase, days 1 through 5. The word prodromal comes from the Greek meaning running before. It refers to the early symptoms that precede the main event. And in hantavirus, the prodromal phase is deceptively ordinary. Fever, usually between 38 and 40 degrees Celsius. Profound fatigue. Severe muscle aches, particularly in the large muscle groups of the thighs, hips, and lower back. Headache, chills, sometimes nausea, vomiting, and abdominal discomfort. Notice what is absent. No cough, no runny nose, no sore throat, no congestion. That absence is critical, and it is the thing that makes this so difficult to catch. A patient walks into an emergency room or a clinic during phase 1. The doctor sees fever, muscle aches, fatigue. No upper respiratory symptoms. They think, viral illness, probably influenza or a flu-like syndrome. Rest, fluids, come back if it gets worse. And they are not wrong to think that. Because 999 times out of 1,000, that presentation is exactly what it appears to be. But in that one case, the hantavirus case, the patient goes home, and the virus continues its work. Phase 2, the cardiopulmonary phase. Days 5 through 10. This is when everything changes, and it changes with terrifying speed. The patient notices a new cough developing, a tightness in the chest, difficulty taking a full breath. They may feel their heart racing. They may feel dizzy and weak. And within hours, not days, hours, the breathing deteriorates rapidly. By the time they return to the hospital or call an ambulance, their oxygen saturation may already be critically low. Their chest X-ray shows bilateral infiltrates, both lungs filling with fluid. Their blood pressure is unstable. They need the ICU immediately. Supplemental oxygen, often mechanical ventilation, and in the most severe cases, ECMO, a machine that takes over the function of the lungs entirely, oxygenating the blood externally while the lungs try to recover. Phase 3, the convalescent phase. For patients who survive the cardiopulmonary phase, recovery begins. Gradually, the immune response settles. The capillary walls regain their integrity. The fluid in the lungs reabsorbs. Breathing improves. But recovery is slow. Fatigue can persist for weeks or even months. Some patients describe feeling like their body needs to relearn how to function at full capacity. Now, here is the one clinical clue that can catch hantavirus during phase 1 before the lungs collapse. A low platelet count in hantavirus infection. Platelet counts drop early and significantly, often before any respiratory symptoms appear. When a physician sees a patient in phase 1, severe flu-like illness, no upper respiratory symptoms, and on the blood count a falling platelet count, that combination should immediately put hantavirus on the differential diagnosis. Combined with an exposure history, even something as casual as cleaning an old shed weeks earlier, that clinical picture warrants urgent investigation. This is why telling your doctor where you have been and what you have been doing matters so profoundly. A doctor cannot factor in an exposure they do not know about. Your history is part of your diagnosis. Never forget that. I am putting the full 3-phase timeline on screen right now. Screenshot it. This is the kind of diagram worth keeping and sharing with people who might need it. Let me clear up a dangerous misconception right now. Hantavirus is not only a disease of remote rural areas. It is not only a disease of farmers, ranchers, and outdoor workers. Yes, those populations face higher exposure risk. But hantavirus cases have been documented in suburban neighborhoods, in city apartment buildings, in vacation cabins just an hour outside major metropolitan areas. Here are the specific scenarios that have been linked to confirmed hantavirus cases. Cleaning out a garage, attic, basement, or garden shed that has been unused for months, or that showed signs of rodent activity. Staying in a vacation cabin or rental property that was closed up over winter or off-season. Working in an agricultural building, barn, or grain store with rodent activity. Hiking or camping in areas known for deer-mouse populations, particularly sleeping in enclosed shelters or tents near food sources. Disturbing rodent nests during yard work, gardening, or land clearing. Working in older buildings undergoing renovation where rodent infestations behind walls are disturbed during construction. And here is the statistic that I think is most important. Studies of confirmed hantavirus cases show that the majority of infected individuals reported no obvious rodent contact. They did not see mice. They did not find visible droppings. They did not have a known infestation. They simply spent time in a space where rodents had previously been. This means the risk is far more widespread than most people assume. And it means that awareness, knowing what hantavirus is, knowing the symptoms, knowing when to mention a potential exposure to your doctor, is genuinely life-saving information. I want to be completely honest with you about treatment, because I think you deserve the full picture. There is currently no specific antiviral medication approved to treat hantavirus pulmonary syndrome. Ribavirin, an antiviral drug, has been studied but has not shown consistent clinical benefit in HPS cases, though it may have some value in the hemorrhagic fever strains seen in other parts of the world. So treatment is entirely supportive. The goal is to keep the body alive and stable while the immune system, hopefully, brings the infection under control. In moderate to severe cases, this means ICU admission, supplemental oxygen delivered at high flow, mechanical ventilation when the patient can no longer maintain adequate oxygenation on their own, extremely careful fluid management, because giving too much IV fluid to a patient with already leaking pulmonary capillaries can rapidly worsen the lung flooding. And in the most severe cases, ECMO, extracorporeal membrane oxygenation. This is a circuit of tubes and a machine that removes blood from the body, oxygenates it externally, and returns it, bypassing the lungs completely and giving them the rest they need to potentially recover. The overall survival rate for hantavirus pulmonary syndrome in patients who receive full ICU-level care is approximately 60 to 70%. Let me put that another way. Even with the full resources of a modern intensive care unit, 30 to 40% of patients do not survive. The single most important determinant of survival is the speed at which a patient reaches appropriate medical care once phase 2 begins. Every hour of delay in the cardiopulmonary phase is an hour of additional fluid accumulating in the lungs. An hour of falling oxygen, an hour of increasing strain on the heart. If you or someone you know develops sudden, severe shortness of breath, especially following a flu-like illness in someone with any potential rodent exposure, this is a medical emergency. Call for emergency services immediately. Do not drive yourself. Do not wait to see if it improves. Time is not on your side with this disease. Now let us talk about the most empowering part of this entire conversation. Hantavirus, despite everything we have just covered, is entirely preventable. With the right knowledge and the right precautions, your risk of exposure can be brought close to zero. Here is exactly what to do. Number 1. Never dry sweep or vacuum areas with rodent droppings. This is the single most dangerous thing you can do in a contaminated space. Dry sweeping launches viral particles directly into the air at face level. You breathe them in before you even realize what has happened. Instead, prepare a disinfectant solution. A mixture of bleach and water, 1 part bleach to 10 parts water, works effectively. Spray the area thoroughly. Let it soak for a minimum of 5 minutes. Then wipe up the droppings with paper towels and place them immediately into a sealed plastic bag for disposal. Never go back and resweep. Seal, bag, and dispose. Number 2. Wear the right protective equipment. An N95 respirator mask, not a standard surgical mask. A surgical mask does not filter particles small enough to stop hantavirus. You need an N95 or higher. Rubber gloves, ideally nitrile. And if the contamination is significant, disposable coveralls to prevent particles settling on your clothing. Before you remove any of this equipment, wash your gloved hands with disinfectant first. Remove the gloves carefully without touching the outside surface. Then remove the mask. Number 3. Seal your home against rodent entry. Mice can squeeze through a gap the size of a dime. Rats through a gap the size of a quarter. Inspect the exterior of your home, particularly around pipes, utility lines, vents, and foundation gaps. Pack any gaps with steel wool before sealing with caulk or foam. Rodents cannot chew through steel wool. Check under doors. Even a small gap at the base of an exterior door is enough for a mouse to enter on a cold night. Number 4. Remove food sources. Rodents enter homes and buildings primarily in search of food and shelter. Store all food, including pet food and bird seed, in hard-sided sealed containers. Do not leave food out overnight. Clean up crumbs and food debris consistently. And if you compost, use a sealed composting system rather than an open pile near the house. Number 5. For significant infestations, call a professional. If you discover evidence of a significant rodent infestation, large numbers of droppings, gnaw marks, nesting material, do not attempt to clean it yourself. A professional pest control and remediation company has the training, equipment, and protective gear to handle this safely. This is not a situation for DIY cleaning. I am putting a full prevention checklist on screen right now. All 5 steps laid out clearly. Screenshot that. Save it. Share it with someone who does outdoor work, who camps, who has an old garage or shed. This information belongs in as many hands as possible. Before we close, I want to give you a brief but important picture of where hantavirus stands globally right now. Hantavirus is not a disease of the past. It is not a historical footnote. Cases continue to be reported every year across North America, South America, Europe, and Asia. Climate change is expanding the habitat range of many rodent reservoir species, which means potential exposure zones are shifting and in some regions growing. In South America, particularly in Chile, Argentina, Brazil, and Bolivia, hantavirus outbreaks continue to occur with some regularity. The Andes strain found in South America has an added concern that most other strains do not: limited evidence of person-to-person transmission, which makes outbreak management significantly more complex. In Europe, Pumala virus causes tens of thousands of cases of hemorrhagic fever with renal syndrome every year, predominantly in Scandinavia and Central Europe, with case numbers spiking in years when bank vole populations boom. Research into hantavirus vaccines and targeted antivirals is ongoing. There are promising candidates in development, but as of today, no approved vaccine exists for use in general populations outside of limited regional programs in parts of Asia. What this means for you is simple. This is not a virus you can assume someone else is handling. Awareness, personal community-level awareness, remains the most powerful tool we have. Let me bring this all together. Hantavirus starts like the flu. Fever, fatigue, muscle aches. No cough, no runny nose, no sore throat. And for the first several days, it is almost indistinguishable from something ordinary. But between day 5 and day 10, it can become catastrophic. Lungs flooding with fluid. Oxygen collapsing. A race against time to an ICU. The red flags to watch for. Severe flu-like illness without upper respiratory symptoms, especially following any potential rodent exposure. Low platelet count on blood work. Sudden onset of shortness of breath following those early symptoms. If any of that happens, go to the emergency room immediately. Tell them exactly where you have been and what you have been doing, because that history could be the difference between a correct diagnosis and a missed one. Protect yourself. Wet cleaning only. N95 respirator. Sealed entry points. Store food properly. Call a professional for significant infestations. And share this video. Seriously, send it to someone who camps. Someone who has a garage or a shed. Someone who works in an old building. Someone who just moved into a home with a history of rodent activity. This is exactly the kind of information that saves lives. But only when it reaches people before they need it. Hit the like button if this gave you something valuable today. And if you are not subscribed yet, our goal is 1,000 subscribers, and I would love to have you with us every single week. Hit that button now.